Hi, and welcome to the second installment of Frank and Mary in Westborough. And you all know Shelby Marshall. Some of you know me. My name is Arthur Bergeron. I'm an elder law attorney. And Shelby and I are doing a series of shows for over a year. We started last month on senior issues that are of importance. And I know Shelby and I had talked about the fact that several of those issues come out of the dementia-friendly initiative in which you had been involved over the previous year,
Yes,
right?
yes.
In which you were trying to really kind of formulate what could really be helpful to folks in the town,
Right.
among others, folks who have dementia.
Right.
And one of the issues that I remember you talking about right off the top was this notion of focusing on honoring choices, which is like, well, what is that exactly, right? And so to talk about that and get a sense of the background for that, you suggested that we invite our friend Ellen DiPaola. So why don't you introduce
Yes.
Ellen, and then we'll just kind of talk about honoring choices. How's that?
Excellent. Well, thank you, Arthur. It's great to be hosting again here today. And welcome, Ellen. I will allow you to introduce yourself with all of your credentials, but it's a pleasure to have you. You've established an amazing program that is now, started with a concept really, and now is really kind of proliferating throughout many parts of Massachusetts. So first of all, tell us about who you are and a little bit about your background.
Yeah, like what are you doing this stuff for?
Right?
How did you
Yeah.
end up doing this?
How did I do this?
Yeah.
Well, thank you for inviting me. It's been a pleasure to work with you, and both a little bit as partners, actually, in this endeavor. So I came to this work as an attorney, actually, as a guardianship attorney, and I worked a lot with different populations, pro bono populations, and generally older folks in Massachusetts. And as we came to learn that they needed guardianship, it was really interesting to me to be able to talk to clients about how did we get here. Because as you know, that if typically if people do a simple healthcare proxy and they assign somebody to make decisions for them, then that person can do that right throughout their lifetime. And if we don't do that in Massachusetts, then if somebody becomes incapacitated, meaning they can't make decisions for themselves any longer, there's a medical condition. There's a medical condition that exists where people lose that ability or maybe never had that ability. The court will step in to protect folks, and that's where guardianship comes in, and the court will help identify a guardian. Sometimes it's just the husband and the wife or someone in the family, and they'll be able then to take over that role of advocating for people.
And by the way, so once again, as a person who's gone through
Yeah.
that process, not nearly the number of times that you did, but just enough to know how bad it is,
Yeah.
could you just give people a sense in a minute?
Sure.
How does the guardianship process work
Right.
so that they get a sense of why they don't want to be there?
Yeah.
Right?
And that was so interesting to me, is how many people I was working with who didn't have to be in this situation. So imagine a couple who's been married for 45 and 50 years, who've just helped each other through everything. But let's say the gentleman and the husband in that situation developed a medical condition like a stroke or maybe advanced Alzheimer's, and couldn't make decisions any longer because he hadn't done that healthcare proxy. Once you lose that ability, as you know, you can't do it then. And so you're kind of stuck.
And maybe Alzheimer's even, it can kind of sneak up on
Right.
you. But a stroke, it's like that.
It's
right?
instant,
Right.
right, and that's what really frightens families.
Yeah.
Because there's such a loss of control all of a sudden.
And then what do you have to do? So I'm the
Yeah.
wife now. What do
Yeah.
I have to do to become that person's
Yeah,
guardian?
and that's what's so difficult, is to be able then to, usually people have to hire an attorney, even though you can do this process yourself, it's hard to do. It costs money to do, it's a lot of time too, even though you will ask the judge, you'll petition the judge to say, I'd like to be my husband's guardian. Such a tough thing after so many years of marriage, and then where after much paperwork and time and money,
Not to mention going to court.
Right.
When you go to court,
you
The
have to
stress
go
of
to
that.
court, and
Yeah.
that's where I really did a lot of talking with folks, because even though it can be a 5 or 10 minute in front of the judge, you are there for 4 and 5 hours waiting for that hearing.
Sure.
So really stressful for families, especially when one member has such complicated medical conditions at the time. So the judge will look at the family, look at the medical history, there's a medical certificate that comes in. Again, very hard to have to go through this
Coordination
when
of
somebody's
paperwork,
sick.
right.
Yeah.
Mhm.
So
And
one-
time,
and time
like
and money.
months.
Right.
Yeah,
And again, all avoidable with a 5-minute healthcare proxy.
So two questions sort of on that for our
Mhm.
viewers. So one, if you can speak to the difference between guardianship and conservatorship,
Mhm.
right, and how those sort of track differently.
Right.
And then what is this healthcare proxy thing? Let's not
Right.
assume folks
Yeah.
know what that
No,
is.
and we can talk about that. But if we just go back to guardianship, say
Yeah.
you didn't do two things. There's actually two things. It's
Mhm.
a great question. If you didn't appoint someone to be your agent in a legal document called a healthcare proxy, then if you become unable to make decisions, we go to guardianship in Massachusetts. We have the court step in for the safety of the people.
Of course.
You know, so the cousin from Ohio who you've never seen in 50 years doesn't come
It's
in
all
and
of a
take,
sudden interested.
yeah, take charge of your life. Then that's guardianship. The other thing that's important, as you know, Arthur, in Massachusetts, is to appoint somebody to be your financial decision maker.
Right.
Because if you lose that capacity to, or that ability to make financial decisions, what happens in Massachusetts is your bank accounts will lock down.
Right.
You know,
Right.
and if you haven't made other provisions. So either, you know, even having someone in your family who's not on your accounts be able to pay for your care becomes impossible. And
Right.
that's when we go to a court process called conservatorship.
Right.
And this, quite frankly, is even worse.
Right,
This is
of
actually
course.
very expensive. It's hundreds and hundreds of dollars in time
Mhm.
to be able to do this.
Right.
So we can avoid both of those things,
Right.
and that's what Honoring Choice is. That's how it came about, quite frankly. Just
Great.
listening to the stories of all these families and thinking, they don't know their simple rights here. And what they told us was really interesting, which is that they didn't actually know where to find documents. If they didn't want to hire an attorney, and many people don't, apologies to you and me, but that was true, for a healthcare proxy, you know, where do we find these documents?
Right.
So that's what Honoring Choices was about. We wanted to do two things. Put these free documents up on the website so anybody could use them, and then to give these documents to people, quite frankly, like Shelby, who
Mhm.
runs an organization right at home, who interfaces with folks every day, so that she could use the tools.
Right.
And so we have now thousands, actually, of community partners, like you, across the state.
Because you actually started the Massachusetts piece of honoring choices, right?
That's right, 5
And-
years ago. I
And you
think.
said there were a few of these, if I recall correctly, you want some in other states.
Yeah, there's
it's-
about 9 of them, but this is,
Yeah.
Massachusetts is unique because we're not
Always.
focused.
Right.
That's what
Unique.
I've learned.
Right?
And we're not, it's because we're not focused on end-of-life care here,
Mm.
but we're saying, look, you have a right at 18 years
Yeah, so
old
important.
to make decisions for yourself. And one of the first decisions is to say, hey, if I get sick tomorrow, if I go and play soccer and get hit on the head and I'm not able to communicate with my doctors, I need an advocate. I need a healthcare proxy to step up just to help me get that care while I'm recovering.
Because, by the way, if I'm 18, my mother can't do that.
That's right, and that's
Right.
what a lot of mothers and children find out the hard way.
Right, right.
Um,
And you make a
yeah.
great point, Ellen, that, you know, when we think about healthcare proxies, and when I've traditionally thought about it, and I think most of even our viewers, we think immediately it's end-of-life care.
Right.
Who's gonna make that decision, that critical decision of
Mhm.
life support or what have you? But to your point that you just made, this
Mm-hmm.
is really about healthcare planning throughout the continuum of when we're adults.
Exactly.
And it is so
Right.
important. So for example,
Mhm.
families who have children going away to college, right? And they're turning 18 and they're now going to school in Ohio,
Mhm.
right? And God forbid something happens, even for a short period of time. We're not even talking about kind of where, you know, they're incapacitated for a
Right.
long time, but they could be incapacitated because, to your point, they, you know, kind of got hit on the head with a
A
soccer ball,
soccer,
they're, you know,
right.
kind of, you know, concussion, what have you.
They're in the infirmary.
Exactly.
What do we do?
Exactly.
There's no one to call.
So the importance
Yeah.
of that healthcare proxy, so that a physician, a facility, a hospital can say, okay, this person has one,
Right.
and it's whomever it is,
That's right. Yeah.
gives everyone a comfort level that they're talking, because HIPAA, of course, is very important, right?
Mhm,
You know,
mhm.
health insurance, that
Right.
Privacy Act, so.
Yeah.
The health insurance account, I forgot it now.
Privacy and
Portability,
Portability and Accountability Act.
HIPAA,
Yeah,
yes,
right.
that's great.
Yeah, HIPAA.
Right, whatever it
yeah.
is. That's great.
Yeah,
So-
and
oh,
it's
sorry.
and it's something actually I found out as a mother, quite frankly,
Yeah.
maybe 7 years ago when my son went off to college. He was on the rugby field in
Mhm.
Connecticut. He got hit on the head.
Love
His
rugby.
friends,
Yeah, I'm an
his
ex-player.
friend, me too. His friends brought him to the hospital, and when I called as a mom the hospital, because I couldn't call the school, it was Saturday. I
Right.
said, I hear my son is there. The response was, we can't tell you. We can't tell you who's here. We can't tell you his condition, because we don't know who you are.
We don't know who you
Wow.
are.
Yeah.
Right.
And so that's
Right.
why having that healthcare proxy at 18 and above is really important. And for us, it
Yeah.
really is about getting the care you need when you need it, you know.
So I want to get back to the,
Mhm.
well, how do you carry around this healthcare proxy thing? Because you've got a great little tool in a card, which we'll talk about
Mhm.
in a minute, that's part of the kit. But when we think of a healthcare proxy, and I'm surrounded here by attorneys, which makes me feel very safe, by
Makes
the
you
way.
feel
Uh,
so nervous
Yes,
about being
my
sued,
palms
right?
are
Oh
sweating.
my God, yeah.
But when we think of it, it becomes a legal document, but you actually don't need an attorney to complete it, right? Can you
You
talk a
don't.
little bit about
You
that?
don't, yeah, and that's what's lovely about the law in Massachusetts. When it comes to this, at least this one document, it really says you have the right to do this at 18. You can do it yourself. It takes really 5 minutes to do. You basically need 2 witnesses, right,
Mhm.
Arthur? And you could speak to this too.
Right, and they can't be the person that you're naming.
Right.
That's the
Right,
only
it just
issue,
can't
right?
be your agent, can't be your alternate agent,
Right.
but you can sit
And
down.
if you're in the hospital, it can't be one of the employees.
That's right, that's exactly right,
Right,
yeah.
unless they're related to you.
Right, yes, that's
Right,
great.
right.
He knows the
Wow.
Oh,
law.
I know. Isn't that good? That's a piece of trivia for
Pretty
you,
good, there
right?
you go.
But it's pretty easy. You know, we go around the state. In fact, we were just at some offices, at some employment offices, because their employers say this is an employee benefit for people. We want to
great.
help. So we did a roundtable lunch. Everybody who wanted to do a healthcare proxy could do it.
Fantastic.
And what was fun is that they knew who their agent was,
Mhm.
and they knew who they wanted to write down. And then we just sat at tables, and co-workers helped each other witness
Nice.
the documents.
Oh,
right
because the
there.
witness, they can be
Yeah,
each other's
right there.
witnesses.
Yeah,
That's
it's
a great
It's
idea.
as simple
That's
as
a great
that.
idea, yeah.
And we've been doing this regularly at the Council on Aging.
Yes.
Same thing.
Yep.
We have everybody come in, we talk about this document, if people are ready, and only if they're ready, or else they take it home and they talk to their family about it.
Right,
We'll sign it right there.
Sure.
And neighbors help neighbors.
great. So tell us a little bit, so the Honoring Choices component has this healthcare proxy, that's sort of what I think of as one of the part ones. I know there are
Mhm.
multiple steps of the program since I've been through the training. Tell us about the other piece, which is,
Yeah.
so important as
Yeah,
well.
personal directive of living will, and Arthur can speak to this, how important this piece is too. So in this state, which is different from most other states.
Again.
And it can get really confusing for people when they go online and they think, okay, all I need's a living will, or all I need's a proxy. And in this state, it's really 2 documents I would recommend, and then certainly there's 5 altogether. But the first
Sure.
2, and what everybody can download from the Honoring Choices website for free, is the
Which, by the way, I
healthcare
think we
proxy.
can put up after.
Yes,
We can provide
yes.
on the bottom
So
or
we'll have that,
something.
yeah, maybe
Honoring
not
Choices,
flashing.
maybe
Yes,
not
but-
flashing like
But so
we
that
are,
everybody
but-
can reach the website,
Absolutely.
yeah.
Right,
Yeah.
very easy.
Yeah, yeah.
So there's the healthcare proxy, and that does one thing we tell people. You get to pick someone to be your advocate,
Mhm.
18 and older, and then by putting that person's name in this document, you give them the power to make decisions for you.
Mhm.
But that's all you do.
If you're
If-
incapacitated.
Right.
Yes, that's right.
If-
Only at that
If your
point.
doctor says you're incapacitated.
And that's an
Right.
important point, your doctor has to do this.
And
It's
then if
not-
your doctor, once again, with the kid that with the hit the
Yeah.
rugby kid. So
Yeah.
if he's better,
Mhm.
and then the doctor says he's better
Yeah.
now, well, then the healthcare proxy's power ends. So it's just during that period that he's really
And
incapacitated,
that's a
right?
really important point
Yeah.
to know, because
Yeah,
a lot
comfort.
of people don't know that, and they think, why should I give this power away to somebody?
Right,
You're only doing it while you can't do it yourself.
and to advocate for you, right,
Right,
right.
yeah.
Mhm.
And so that's what the proxy does, but you want to be able to tell your agent, your healthcare agent, what you want for care.
Mhm.
And one of the things we're stressing is it's really not the agent making decisions. They're really just taking your decisions
Mhm.
and telling your doctors about it and telling your family.
Although, as you pointed out,
Mm-hmm.
one of the reason why I dislike the term living will is because people hear the term, I'm gonna do a living will, and they think that that means they're doing something that's legally binding.
Right.
And while in many states, so-called living wills giving these kinds of directions regarding your care are binding, they're not here.
They're not.
Mhm.
So
Great.
everything is about the healthcare proxy. So when people are signing documents called the famous 5 wishes, and many people
Mhm.
may have heard of the 5 wishes form or other kinds of forms,
Mhm.
the only thing about that document that is legally binding is the first section of the 5 wishes form in which they're appointing the proxy.
Mhm.
Everything else is just advice although very important advice in many cases, to that proxy, because no medical provider is going to listen to any of that or read it. They're just going to want to know who's the proxy.
That's right.
And the
So,
other piece
yeah.
that I would also add is that just the context of, because I'm kind of still a young person, context of a living
Oh,
will.
compared to us.
I
Shelby.
didn't say that. You drew that
It
conclusion.
just, you know, everybody under
Mr.
about
Bergeron.
50 now just looks young.
So, but living will sort of implies to me like will, end of life, something like
Right.
after that
Oh,
I'm
yeah,
here,
yeah, that's
right?
true. Yeah,
So I think
yeah,
it's really
good point.
important for our viewers to understand, and you know, maybe you can, not to put you on the spot, but give us some examples of like, you know, what's in a personal directive, like what are, and
Yes.
maybe sort of across in a couple minutes, the continuum of someone who's very young versus someone who has, you know, a terminal diagnosis, and
Yeah.
kind of how those might differ.
Well, that's why, it's exactly why we renamed this living will thing, because there's a lot of names for it in Massachusetts as a personal directive. To your point, Arthur, is to say this is a personal document. It's like a letter to your doctors, to your family, so that it,
and to your proxy,
and to your agent,
to the proxy
Right.
saying,
Right.
yeah, look,
here's how I want to be treated.
that's right. Here's what's and it has two parts. It's not just about the treatment, because we can't always predict what that's going to be.
Right.
But the first page it's easy. It's just, you know, what's important to you. What makes life worth living? How do you define quality of life? Like, if I got sick tomorrow, what would I want my healthcare agent to know about what I wanted them to tell my doctors about? You know, what makes a good life for me? People have used this first page as just thoughts and reflections to put down their spiritual beliefs,
Sure.
you know, that's important to me, and who to contact. Like, I want you to contact this doctor, or I want you to contact this neighbor, or
Right.
my clergy.
Or your
Right, so
clergy.
for me, and I don't know if this would be
Yeah.
something to
Yeah.
put in there, but, you know, if I were incapacitated for a long period of time, have the ability to see my dogs would be really important to me, you know?
would be amazed how many people talk about their
I shouldn't say, I didn't say my
That's-
wife first,
no,
that's
no,
gonna be
no.
a problem, right?
It's
That-
it's
Can we
just
edit
the
that part of the
reality.
tape?
No, it's just the reality. It's all
No, but that
about
might, that's
the
like
dog.
a very non-medical,
It's
but something very
really-
personal that
Yeah.
I think, you know, even in an incapacitated, that I might
Yeah.
find soothing.
Yeah.
That's right.
you know.
And it's not
Yeah.
it's not a medical decision,
No.
but it's
This
the
is
kind of thing that the
personal.
person
It's
who
about
is your
my care.
proxy, who,
Right.
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 And to that extent, it is a medical decision. It really is
Well,
about
no,
your
but
care.
you
No,
were
but that's, you're
talking
right. No,
the
you're
technical
right.
term of
Yeah,
I do or
yeah.
I don't want, you know, enteral or, you know, sustaining treatment. Or
Treatment,
whatever.
yeah,
That's
yeah.
obviously very clinical, right?
Right. And we do that on the second page, but we actually flipped most living wills to say, you know, let's just say what's important to me.
Right.
And it's so interesting when we do this together, what people share. And we have a lot of our senior folks now just talking to each other
Yeah.
about what's important, and that experience about life and what they've learned, or they're really helping each other
Yeah.
with understanding what's a quality
Yeah.
piece for me. So you do that on the first page, you fill out as much as you want, you come back to it anytime you want and change it.
And
It's
you can
your
change it.
personal document.
And that doesn't
Yeah.
need to be witnessed or
No.
notarized or
Right,
anything.
exactly.
And I know for a lot of my folks, because when we have these conversations, and I've tried to bring up honoring choices in quite a few of the seminars last year, and I just talked to them about it. And so in terms of, you have a stroke, or you know, you have a disease that causes dementia and things have gotten severe. So now it may be that this proxy that you thought you had done just to take care of end of life,
Right.
maybe you're guiding a person through what could be years of your life, at least months, but maybe years. And it goes to that question of, so what is really important?
Right.
Because a piece of the decisions that proxy is then making is not, how are you going to treat this disease, but do I want to treat that disease?
Right.
If I am in a condition where what I think is where the quality of my life is, in my opinion, not a quality that I think is especially worth continuing, then not necessarily the proxy is not going to. I'm not saying go shoot me, well, because it's the wrong state, so I can't do that here. But I can say, you know, if I get cancer,
Right.
I don't want to go through a whole lot,
Right,
you know,
right.
if it turns out that I'm only going to be better to a point where I don't want to be in the first place.
Right.
Right.
Which is just really, I mean, that sounds kind of hard-hearted, but it's and for the kids, I think it's hard-hearted.
Yeah.
But for the seniors get this,
Yes.
right?
Yeah.
It's like seniors get, I'm going to die. Guess what? I'm old, I'm going to die. But there are but it's, the question is, what's the quality of the rest of my life?
Right.
Well, I
You know?
think, I go back to, when my grandmother, as she got into her mid-90s, and we had a lot of conversations. She was forever dying at, for 10 years, which, sort of became one of those
Yeah, one of
things,
the-
with
like
love
a-
and affection,
right,
but
right.
Graham is still here for Christmas.
Yeah.
And,
How does she do that?
but she and I had very, kind of intimate conversations about, dying and but I wasn't her healthcare proxy. So she could speak to kind of, here's what I do or I don't want any pain, I don't want this, what have you. And thankfully we had great family relationships, and that her daughters, kind of worked cooperatively together, which, is not always the case, to make sure she had a very, a positive end of life experience, if you will. But that doesn't always happen. And I, not as her agent, I could talk till the cows come home, but even if she had a personal directive and I wasn't that person, it would
Yeah.
be very difficult to kind of connect those dots and then guide the treatment or her care. So it is so important, no matter where you are on the spectrum of your life.
Yeah. And one of the things that's been marvelous about the personal directive is, the truth is, we don't all have agents. We're living
True.
a whole lot longer. We don't have sometimes family that are local or family that we are close to be able to feel comfortable.
Right.
And sometimes we talk to seniors and lots of people who have so many family, they actually don't know who to pick as an agent.
Good point.
Or they're afraid to pick one.
That's
Oh,
right.
I don't want to leave so-and-so
Right,
out.
right.
That's
You
right.
know?
And
Right.
as they think about that, what we say very clearly with the Honoring Choices tools is, look, you don't have an agent, no problem. Just start your healthcare plan with the personal directive.
Oh, now
Because-
that's an interesting point.
Yeah.
Yeah, and
So you
it's,
can
it's,
start to think about it, right?
Don't
Really.
not put in
Yeah.
how you want to be treated just because you haven't figured out this one role
that's actually
for
right.
that one person.
And it's
Yeah,
been
yeah,
working.
yeah.
It's really interesting as we travel the state for the last 5 years that we assume that it's just seniors who don't pick agents. It's been every age group from 20 on up, every type of person. It's just the society we live in. And so what we want to say to people is, that's okay, you don't have an agent. It's fine for now, and even but what you have is a right to make choices.
So important.
And you want to write that down in that personal directive. The other great things is, I would say maybe 5 years ago, the doctors weren't so sure they wanted to take that document and put it in the medical
Put it in
record,
the file.
Just
but
gonna
they're
ask you about
doing
that.
it now.
Yes.
Because they're coming up against patients, especially in our hospitals, they've never seen before. And they don't know anything about that patient. And then there's no agent to call. So they actually like having that proxy to learn a little bit about the person who they're treating.
Right,
Now,
right.
isn't that an interesting point?
Yeah.
Yeah, that's true. That
Yeah.
the assumption when you went to the hospital
Right. My
20
local hospital,
years
my
ago,
local doctor.
it's my doctor.
Right.
It's done my family, and they know so they're just kind of intuitively going to know kind of how I want to be
Right.
treated,
Right.
and that's just
Right.
no longer the case.
So you're saying that individuals could take the healthcare proxy, they could take their personal directive, give a copy to their physician,
Absolutely.
any of their physicians, right? So if
Or
they're seeing
all.
multiple, any and all, right, because most of us
Yeah.
are not just seeing
That's
one.
right, yeah.
Right.
Do you recommend that those documents are also, that the agent also gets a copy?
Yes,
Tell us about that.
absolutely. And again, this is what we go back to with Honoring Choices. This is your right. These are your documents. We've actually taught people that they're not their documents, that other people control them.
Oh, sure.
You should have a right. You should have a copy on hand so you can make changes.
Right.
What we say is, you own it. You can change it
You can
anytime
and you can
want.
revoke the healthcare
You-
proxy at any
You
time.
can
Absolutely.
tear it
You
up.
can pick
Yes,
somebody
sir.
else.
Yeah,
Say, I don't
right.
like that daughter anymore.
That's right.
She's gonna kill me. I want to stay alive. Or alternatively,
Yes,
and I
right.
suppose that's also a piece of kind of the decisions when you were just talking about
Right.
when you have multiple kids.
Right.
Is you need to say to yourself, ultimately, so who's really going to honor my choice?
That's right.
Well, and
Because
who-
sometimes they
who's good
don't.
at
You
that,
get one
right?
that doesn't,
Right.
or that just freezes up.
Right.
I'm not going to be responsible for my dying.
Right, right,
Right.
It's
right.
not going to be
Yeah.
on me.
Right,
Well,
right,
well,
right.
great.
Or, some
unless
people are
you're
gonna be
mom.
really good about, this person clearly can kind of handle my financials in the first, when we
That's
started
right, the
talking.
financials.
And they're gonna be really good at that, but that person would not be good in sort of maybe an emotionally charged situation where, literal
Absolutely right.
life and
Right.
death situation.
Absolutely
Right. Do you want your accountant making the decision on whether you're going to live or
Probably
die?
not.
Well, maybe.
We actually have
Maybe they're gonna think about
Tax
it
benefit,
different.
no tax benefit, no, just kidding, kidding.
We also have a little club that there's a lot of folks who have very happy marriages where women say to me all the time, my husband is never going to be my
Sure,
proxy.
yeah.
Because he couldn't
loves
make
me,
the decision.
But he couldn't make the hard decision.
Yeah,
And
yeah.
so that's fine to know.
Yeah.
And so what typically happens is there's a daughter or a son, there's a friend,
Yeah.
and the
Yeah.
husband gets included,
Of
but
course.
then they help each other.
Yeah.
So, and I love those stories because people are really thinking and talking
Sure.
to their family members about, how can we help each other?
Sure.
Now, I just as,
No, please go
I
ahead.
was just gonna say, just a curiosity now, so you've heard those stories just a jillion times. Are there any that really strike you that when you kind of you say to yourself, now here are some things that were in the directive, right? That were just really important, that really helped somebody down the line,
Yeah.
to do something in a different way. I'm just curious.
Well, I think I just heard from my son, who's an ICU nurse and an emergency room nurse recently, who calls me at all hours of the night because he knows
Get
I'm
advice.
up. He knows I'm up. So it goes back to this gentleman who was, I think, in his 70s, lived alone still very well, actually was in his 80s, had a major medical problem where he was rushed to the hospital. But when he got there, nobody knew who he was. Nobody knew if he had documents or family. So one of the things he had done a healthcare proxy, he had done a personal directive, and he had filled out the little wallet
Oh,
card.
tell us about that. I love this part.
Yeah.
This is
There's
great.
a little wallet card that says, if you do your healthcare proxy, that's the legal document, right? And then you can put in a little wallet card that says, I have a healthcare proxy. And on the back is the name of your agent and their phone number.
Right.
So
And
they
you've
found
actually produced these little cards,
Their
right?
cards
So
are
this,
easy
you
to-
told us
yeah.
about this, and we're like, this is the greatest tchotchke
Yeah,
that I've ever
exactly,
seen.
exactly.
This is like a
People
really
it. We went
handy
back to
thing.
the old school. Put it in your wallet,
Right.
because in the emergency room they can't always open your phone. They can't
Correct.
always have your phone,
Right.
but they might have a wallet or a pocketbook.
Right.
So back to your point is he called me to say, Mom, you're not going to believe this.
Oh, stop it.
But there's a card, and we were able to find his daughter
Oh,
immediately, who was his healthcare agent, who was incredibly grateful because she didn't know her father was that sick.
Right.
Right, you
And he
know,
was
right.
very sick
Sure.
at that point. So she was able to quickly go to the hospital with his healthcare proxy and his personal directive and make these very personal decisions. And they had talked a long time
Yeah.
about, I want my daughter to take care of my animals when I'm, so
Yeah.
it's one of the first things she did
Yeah,
was
yeah.
after she left
Who's
the
in charge?
hospital.
Yeah, right.
It was to, of course,
Get
feed
the
the
dog.
cat.
Yeah, yeah, yeah.
Don't worry about me.
Right.
Feed the cat.
Feed the cat.
Exactly.
So those directives are very helpful to
Yep.
the person who then is in the trauma of, I want to help my dad, and also, what do I do first?
Yeah.
What's
What do I
most
do first?
important to
Right,
him?
right.
So,
And I think it's so important. So I love the card idea. So even if even if it's not the Honoring Choices card, what I would say to viewers, if you have a healthcare proxy, and you can go to honoringchoicesma.com,
yeah,
correct?
That's right.
And download the healthcare proxy form and the personal directive form. You just print out something and put it in your wallet that says, I have a healthcare proxy,
Right.
and here's the person. So even in lieu of that card,
Yeah.
Right.
because
Yeah.
you're right, because some people you can't, even if you have an ICE on your phone,
Yeah.
if someone doesn't know your password or how to get in,
It's hard to get in.
it's, they may not know
Yeah.
that.
And I think that from your perspective, Shelby, the fact
Yeah.
that this came up in the course of the dementia-friendly community
Yeah.
stuff just was so appropriate, because
Absolutely.
while the goal is to have everybody have one, there are some populations that are just more at risk, and the older you get, the more at risk you are
Yes.
of any of these possibilities occurring. So the notion of trying to that just building that in so that you know that if you end up with serious memory loss and you can't remember what this stuff is, or you can't remember exactly right,
Right.
it's all done. It's all
Exactly.
done.
So
It's just one of those things that you can
Peace of
just
mind.
put it to bed.
And not
Just
just
put it
peace
to
of mind
bed.
for you, so much of it is peace of mind for the
Oh,
caregivers
the
who
kids,
surround
and the
you.
kids.
Yeah, your wife, your spouse, your kids, what have you. It's so important. It's I know folks pre-plan their funeral, and that sounds sort of morbid, but there's such peace of mind for folks. It's like in a time where people are grieving and they're worried about all that.
And
It's
you
just,
want,
so
yeah,
this
you
is
want
kind of
your
my
kids to have to be
analogy.
going to the funeral home
Yeah,
and figuring
whereas,
this stuff out.
it's like I've kind of already got it, it's like, okay, well, we can kind of, grieve together and be together, or, and so back up to a healthcare crisis, this really will help families. So I think that Westborough will hear more about honoring choices as a component of the Dementia Friendly Initiative. Certainly, Arthur and I
We'll
are
keep her involved.
resources. Oh, absolutely.
We'll use her as the, right.
Absolutely.
Because I think this, we talked about really trying to make Westborough one of the communities that's really leading this, would just be a great idea.
Absolutely,
Just a great
absolutely.
idea.
So-
And totally consistent with where you and your group really wanna go in terms of a
Absolutely.
dementia-friendly community.
Absolutely, absolutely.
So, thank you so
Yeah,
much,
thank you.
Alan.
Thank you.
This
Thank
is
you.
just
Pleasure.
great. It was just great. We really appreciate it. We'll hope that you'll still come back to
Of
Westborough
course,
and kind
we'd
of
love to work with here in Westborough.
and visit us here. This is gonna be a lot of fun. And I think it really is kind of inspiring to know there's a way to do this. A lot of people would say, oh, this is a great idea, but how would we do this exactly? And this gives you,
Yeah. And I think just the one other parting piece is just, I think it's so important that people talk about it. It's not always a comfortable conversation, so,
Right.
I know you've had some experience with, proxy and pies, or
Mhm.
proxy parties, or pizza parties,
Pizza and
but,
proxy.
We're
you
having a
know-
lot of parties in the
Right,
state, we're eating
but-
a lot of pizza.
Right, right.
Where
Well, you know-
people come in and have pizza and do a proxy.
yeah, so, I mean, I think even if folks say, hey, I've got my book club, you know what, before we open that book next week,
Right.
we're gonna download those forms, we're gonna have a conversation and just even talk about it,
Yeah,
so,
yeah.
it's a simple but
Pirates
such
of
an important.
Penzance and Pride.
There you go, there you go.
On that bright
On that
note,
note,
thank you for watching. I hope that this has been helpful for you in terms of understanding some of these issues. We will look forward to seeing you on our next installment of Frank and Mary in Westborough. Thank you.
Thank you.
Thank
Thank you very much, thank you both.